All right, I'm going to want to welcome everyone who's joined us today for our presentation. This is the final one this week. We've had a great week. Sorry for those of you who missed our previous presentations, but the good news is they will be up on our website shortly. Had a nice variety, and so they'll be there. You can go back and watch. And this evening, we're excited that one of our new providers, Dr. Podbilski, is going to be sharing with us as well. I'm going to let him give his background and his abbreviated bio, however he wants to do that, and share with you. And I'm going to ask, I think everybody else is muted, which is what I'm going to do here in a second. If you have questions during the presentation, you have a couple of options. Option one is write it down and ask it at the end. We'll have a time for question and answer at the end. Or there's a button there you can raise your hand as well, and you can let us know, and we'll kind of watch for that. We've had a few people that have chatted in some of their questions as well, and that's certainly okay, and we'll pass that on at the end of the presentation. So without further ado, I'm going to turn the time over to Dr. Podbilski, and thank you very much for taking the time to do this.
Yeah, sir, my pleasure. Welcome, everybody. I'm glad that you had the opportunity to come take a look at the presentations that Arbor Health has been putting on for this week. It's been pretty interesting, lots of good stuff out there. And so if you missed any, go ahead and go back and check out any of the links for the other videos. You just missed a pretty good one from Brian if you weren't there about exercise, which is actually very informative. And so I certainly recommend watching that one because it really ties in pretty well to a lot of the stuff I'll be talking about today as well. Again, my name is Dr. Podbilski. I'm a new physician here. I just started in July. I'm originally from North Dakota. I did most of my training up in Tacoma, and so just moved down to the Valley area because I like being out here, and I think it's a fun place to be, and I thought I would really enjoy working here. One of the things that I'm very passionate about, and one of the reasons I got into primary care, was for preventative disease and preventing those preventable diseases. Metabolic syndrome is something I'm very passionate about, which diabetes is a part of. So metabolic syndrome being a conglomerate of symptoms: high blood pressure, obesity, high cholesterol, and insulin resistance and diabetes. And so I decided to take this time to talk a little bit about diabetes and give you a little bit more information about that. And as Edwin was alluding to there, we can stop for questions. I can sort of pause between each section as someone raise their hand or put something in the chat box, and we can address those as they come up. So today, our agenda will be to sort of define diabetes, talk a little bit more about what diabetes is, kind of get some truths out there and have a better understanding about what goes on in our bodies, how that works, and how we, if you do develop diabetes, how that does happen, how things work in your body, how they're supposed to normally work, and then what sort of things go badly that can lead to diabetes and increased risk of diabetes. Some of the reasons why we care about diabetes, because of the health concerns and the things that it raises your risks for and sort of exposes you to. It's sometimes important to understand why we care so much about something, and so we'll go into some of that stuff and give you a better understanding about why we'll talk about it so much. Prevention, of course, the best thing to do for anything is prevent it. If we can do that, then we're heading down a good path. So we'll talk a little bit about prevention and things that you can do on your own with friends and family to prevent diabetes. One of those being diet and exercise, which again sort of brings back Brian's topic before mine. Exercise and aging was very good. If you didn't catch that, go ahead and watch that one because that'll give you lots of great ideas. How we diagnose diabetes, when you come into your doctor's visit, sort of things that we'll test for. We can talk about medications. I won't get into a lot of detail on medications. There are certainly several and dozens of medications out there to treat diabetes, but we'll get into one of the starting medications that treat diabetes, and then I'll leave some time for questions. So what is diabetes? So in simple terms, which I like to talk in simple terms, it's just the inability of the pancreas to respond to increase in blood sugar after we eat them. And so carbohydrates are made out of sugars. We eat sugars. And if our pancreas can't respond to that carbohydrate load any longer, then we end up having elevated blood sugars. There's two types of diabetes, of course. There's type 1 diabetes and type 2 diabetes. And we are going to be spending our time talking about type 2 diabetes. Type 1 diabetes is an autoimmune disorder, which does involve the pancreas. The pancreas isn't able to make its own insulin. And so folks with type 1 diabetes will actually need to be on replacement insulin. But with type 2 diabetes, that's something that develops over time from chronically elevated blood sugars, and the pancreas starts to just not function as well. And some of you might be saying, what is a pancreas? And so this is a nice little picture here of the pancreas highlighted in orange. That's the abdominal contents there. You can see the lungs on the top and then the pancreas highlighted right in the middle. It's an organ. It releases insulin in response to the sugars that you eat, which get into the blood. Blood sugars go up, and then insulin goes up to try to push those sugars back down, put them in places where they will be able to be used by the body. There's a specific cell in the pancreas, the beta cell, performs this function. It releases insulin into the blood to help take down a sugar load. So the question really is, like, how are things supposed to work? There, not everybody has diabetes, and some people certainly are at a genetic predisposition to get diabetes. But what typically happens, and what hopefully can happen throughout life, is you eat a meal, the body will take in that sugar load from the meal. It converts your bread, your pastas, the ice cream, the pop that you drink, converts all that into sugar that goes into your blood. And then the cells in the pancreas, the beta cells that we talked about earlier, will recognize that there has been an increase in blood sugar. They release insulin into the blood, and then the insulin lowers the blood sugar by moving it to places where it can be used in your body, one of those places being the muscles. Muscles will use the sugar as energy, and so if insulin can push the blood sugar down into the muscles can use that blood sugar. And that whole system just works together really nicely and keeps the blood sugars at a nice stable level. With everything in the body, there's a term called homeostasis, and that's basically a leveling out. And the body likes to be at homeostasis. And so there's mechanisms with lots of different things, not just the blood sugar and the insulin type mechanism where the insulin gets released and to put blood sugars down to where the body likes them to be. The body's full of these types of procedures, and this is just one of them in particular. And here's a graphical representation of exactly what we just said. Sometimes pictures are easier to understand, and so you can see that the blue line being sugar over time. And so you got on the bottom graph there in minutes, and then the sugar load on the left here. And so you eat, the sugars in your blood rise up as the carbohydrates that you eat are being broken down into glucose. Glucose gets released, and as you can see, that starts to come up. Insulin gets released, and that lowers the glucose in the blood back to the normal levels. And then you can see that that line there reaches about the same, and that's your homeostatic line. That's where the blood sugars want to be. And now everything is back to normal when things are working appropriately the way that they're supposed to be working. And so what happens, how do things go wrong, is the question. Like, why does someone develop pre-diabetes, or why does someone develop diabetes or insulin resistance, which we'll talk about here? Too much sugar over time just leads to what we'll all refer to as insulin resistance. And so body cells respond to blood sugars, they respond to insulin, and the more sugar you eat, initially the more insulin gets released, because the body, again, is trying to get to that homeostasis level where everything is where it wants to be. And more insulin will be released, more insulin will be released, and more insulin will be released to try and push down those sugars. You can imagine, if you're looking back at that graph previously here, you've got the blood sugars on this top graph go up to about 125. And so let's say that's a sandwich. You eat a turkey sandwich, and those two pieces of bread get your blood sugars up that high. But if you top on top of that sandwich some potato chips, and then you have a Coke with that meal, and then maybe even you have a little Debbie treat or something as a dessert, you can see that on the left, that sugar is going to keep going up because you're going to continue to put a glucose load into your blood. And so the insulin needs to go higher and higher and higher to be able to push those sugars down. And so the body will start to get used to those really high levels of insulin, and those cells will start to become resistant to the insulin. So they won't perform the same way any longer. because they will need more and more insulin. And this really gets the pancreas working pretty hard. And those beta cells are taking a taxing, the more and more sugar that gets in your blood and the harder that it has to work. And so this will start to become resistant to that, like we're talking about, and that will lead to those chronically elevated blood sugars, despite the pancreas really trying to release a lot of insulin. You can have very high insulin levels and still have very high blood sugars in the body due to the insulin resistance that can develop over time. And so why do we care about this sort of thing? You know, that's the next part of the agenda. I don't see any questions here or any hands raised, and so I'll keep going through. So why do we care about blood sugars being elevated? Why do we care about diabetes? Why do you hear so much about it? Why is, if you watch TV, every other commercial is a new medication to treat diabetes? Well, elevated blood sugars can damage blood vessels. You can imagine that sugar being like a granule, if you put it into water and you're shaking it up with rubber tubing, if you imagine the blood vessels being rubber tubing, it can start to scratch and cause damage to those blood vessels. You know, that can lead to inflammation, that can lead to pain, it can lead to increase in pain if you've already got pain. These, among other things, there's many negative effects that chronically increased blood sugars can have on the body. You can imagine that if your whole body is inflamed, all the processes and all those different homeostasis processes that we talked about earlier can be affected by that. And so it can really wreak havoc on the body. And so we really do try to do everything we can to prevent diabetes. And if you do have diabetes, do what we can to treat it. And of course, there's a large market for medications. And so that's why you see so many of those. And this is just a quick picture. I'm not going to go into everything here, but it's just to give you an idea of really how many places in the body, you know, the heart, the stomach, the liver, the blood vessels, your bones, your brain, your eyes, you know, so many parts of your body can be disturbed by chronically elevated sugars and the inflammation and the damage that it can cause to the body. And so we certainly do care a great deal about this. And I'll go into a few of these, some of the more common ones, or even some of the ones that can be really terrible and that we do something about regularly. And I'll go into a few of those here next. So neuropathy is a big one. A lot of times, if you know anybody who's diabetic, or if you're diabetic yourself, you're familiar with the burning and stinging pain in the feet from what we call peripheral neuropathy, which is caused by diabetes, among other things. But diabetes is certainly one of the more common things that can cause neuropathy. Also, diabetics that have peripheral neuropathy, it can lead to where you don't even feel the feet because of nerve damage at the very small nerves at the end of your feet. You don't have that sensation anymore. One of the feared complications of diabetes is something called osteomyelitis, which is a bone infection. And if you have a wound that goes unnoticed, for example, if any of us step on a nail in the garage, we feel that right away, and we know it hurts. We jump up with our feet. But if a diabetic who can't feel his or her feet step on a nail or step on a tack, or commonly just a rock in the shoe, you know, any of us are walking around the rock in the shoe, we know that, but that can start to eat away at the lining of our bodies, which is our skin. And, you know, it breaks through there. There can be an infection that goes unnoticed, and it doesn't heal very well, again, because of other problems that can happen with blood sugars and the problems with blood supply to different organs, including the skin. And so it doesn't heal very well, and it gets worse and worse and worse. And that infection can actually get to the bone, which is very dangerous. And some of you might know someone who, due to diabetes, has lost a toe or lost a foot or even a leg. And that's why those with diabetes should wear appropriate shoes. And we also ask diabetics to have their feet checked at every office visit. We do something called a microfilament test, where we sort of, with a very thin wire, poke different spots on the foot in order to determine whether or not there's still sensation at those spots on the feet. And then we also ask them to see a podiatrist yearly after a certain amount of time, just to make sure that they're getting checkups. If they do need help getting appropriate shoes, there are specific shoes for diabetics that can be purchased or supplied depending on insurances and things of that nature, which can help prevent foot problems. Vision changes. So diabetic retinopathy is what we're talking about here. And there are different stages of diabetic retinopathy as it starts to progress. And it's caused by damages to the small blood vessels because of that elevated sugar. If you remember the example that I had given earlier, it's kind of a rudimentary example, but if you imagine a rubber tubing with some granules in it and you're pumping stuff through it over and over again, like our blood vessels carry the blood to all of our organs, and things start to get damaged on the inside. And the very, very small blood vessels in our eye are specifically sensitive to that. And so we can end up with what's called diabetic retinopathy. Some of the early symptoms can be just decreased vision, maybe some blurry vision. You can see floaters in the eye, and this can really lead to blindness. It can also lead to decreased ability to see color. And so just like with the feet issue with diabetes because of the neuropathy, because of diabetic retinopathy, we ask diabetics to have what's a specific eye exam called a diabetic eye exam annually. And that can look for the early signs of damage to the eye and early signs of diabetic retinopathy, and try to do whatever we can to get on top of that. Another one is kidney disease. And so kidney disease can be caused from a couple different things. Two of the most common ones are diabetes and then high blood pressure. Of course, if you remember from the beginning here, high blood pressure and diabetes are both part of that vicious circle that we call metabolic syndrome. And so with diabetes, sort of the same stuff, the inflammation, the damage to the blood vessels by the chronically elevated blood sugars, if left untreated, can lead to poor kidney function. And so the kidneys really filter all of our blood. And of course, they produce the urine. And so you can cause problems here. And some folks with kidney damage end up needing dialysis in the future, which is, if you know anybody on dialysis, you realize what kind of a time commitment.
You're muted.
I don't know, whoever said that, where did I get kicked off at? I'm going to go back to heart disease. And so heart disease is another area that can happen as a result of diabetes. And so damage to blood vessels from the increased sugars that we talked about make the heart work harder, and that can lead to problems with the heart and up to and including a heart attack. And so diabetes is another risk factor for heart disease and heart attacks. And so it's something that we pay close attention to as well. And so the question here is, can we prevent diabetes? And absolutely, you can definitely prevent diabetes. And prevention is the key. And as I said in the beginning, it's one of the reasons that I got into primary care is for prevention. Early on, I saw lots of stuff. I was exposed to things that I had really not seen before. And I realized that the place where a doctor can really do the most good is in primary care with preventative medicine. And the honest thing is that this just starts with good old-fashioned diet and exercise. They even have diabetic nutritionists, which can be very helpful. And if you can, see a nutritionist, because my gosh, if you're trying to start a diet and you go online, you're just going to be, bombarded with everything out there. And there's a lot of diets out there, this kind of thing. It's, do I do paleo? Do I do keto? Do I do these shakes? Do I do juices? It can be really daunting to decide what is best for you. And so seeing a nutritionist can be helpful, but then the truth is just keep it simple. A lot of times when I see somebody for diabetes, we talk about one small change at a time. Let's say you're just diagnosed with diabetes or just diagnosed with pre-diabetes, or you even just want to prevent that at all. You have no pre-diabetes, you're essentially living healthy, but you want to make sure that you don't get to diabetes. We can look into the things that you eat and find out if there's some low-hanging fruit, like you drink pop or something like that. We can certainly start to reduce or eliminate that. And that's one big step to decrease the amount of sugar in your blood. And I took this phrase from the CrossFit community. There's a workout nutrition type thing, and whatever you think about their workouts, their nutrition, which is at the base of their pyramid, which is sort of how they view fitness, that their statement is eat whole foods, lean meats, vegetables, seeds, nuts, some fruit, little starch, and no sugar. And you can essentially take that literally. If I'm eating lean meats and vegetables, there's no diet that would tell you that's not okay, unless you're vegan or vegetarian. Then that's something that we could talk about separately. But if you're just eating good, clean, whole foods, you don't have to be on any specific diet. And then looking at to this, you can wonder, like, what does it mean to eat some fruit? What does it mean to eat little starch? And so starches being like your potatoes, your rice, things like that. And so if you're looking at your plate or your meals for the day, just think I've got lots of meats, vegetables, maybe some seeds, some almonds or some macadamia nuts. And then I have some fruit and maybe a little bit of starch. And so some and little, if you've got an apple, you're just having a smaller than that amount of potato or rice. And so just sequentially stepping down the amount, there's no real measurement. Just think that as you go down this list, it's less and less until you get none. And then really what we would like to do is have no added sugar. And exercise, how does exercise help? Again, I'm really plugging Brian's lecture earlier because it was really good. And he goes into, this is more of a diabetes talk, but he really goes into depth about exercise and how it helps with function, fitness, and then of course, reversing and preventing diabetes and metabolic syndrome. But the muscles use sugar for energy, and so they can remove them from your blood. And then of course, there's cardiovascular heart benefits from regular exercise. The recommendation is about 30 to 60 minutes, 5 times a week. And so if you go on a 30-minute walk after dinner, you're getting some good exercise. You're helping out your heart. You're also helping prevent diabetes. And a lot of people, especially out here, it's very true. There's no gym where I live. There's not a 24-hour fitness down the street. There's not a what are the other places? All the gyms that can be out there. There aren't any around, at least not that I have seen in my short time living here. But that's okay. You really don't need a gym. So you don't need a gym to go for a walk. I understand the weather can get bad, and so there's lots of things you can do inside if you don't want to go outside and walk in bad weather. If whether or not you wear an umbrella or suit up for the weather, that's also great. But if you don't want to do that, if that's not your thing outside of the summer, there's plenty of things you can do in your own home that don't require any equipment. I wrote down here squats and push-ups, your sit-ups, stuff like that, like your standard calisthenics type stuff. But if you have stairs in your house, if you can safely maneuver those stairs, going up and down the stairs a couple times, that's great exercise. Going upstairs is really good for your heart. It's really going to get your heart rate up. It's going to get those muscles to, take in that sugar and use that stuff up. And then of course, squatting. I'm not talking about doing anything with a barbell in the gym. If you have that at home, great. If not, I'm really just talking about sitting down in a chair and then standing back up. Do that for about 10 times, and then repeat that 2 or 3 times. You're using those muscles, you're keeping them strong. And then push-ups, if any type of push-up you can do, if you can't get to the ground and up safely, or if that causes a lot of discomfort at this stage, even doing push-ups against the wall, putting your arm against the wall, lowering yourself till your chest touches the wall, and then pushing back out. There's really lots of things that you can do at home that would really check the box for exercise and help you to be healthier and happier here and prevent the diabetes and prediabetes. And so how do I know if I have diabetes? And so this is something your doctor will check for in your annual or your yearly checkups. And this is why it's so important to go see your doctor. We all know the person who never sees a doctor. I see people in clinic that tell me they haven't seen a doctor in 70 years, or then this one thing happened and they go to the doctor, and then we can do some testing, and sometimes we find out things that we really would have liked to find out those 70 years prior. And so if you're one of those guys or girls, or one of those guys or gals who don't go to the doctor, tell them, go check out one of your doctors here at Arbor Health, either in the Mossy Rock Clinic, the Randall Clinic, or the Morton Clinic. See your doctor, establish care, and start getting some of that good preventative care, because we can test for things like that and identify them early before they cause any problems. There's an organization called the U.S. Preventative Services Task Force, and they help come up with recommendations of when to test or screen for certain things. And diabetes, of course, is one of them. And the recommendations at this time are to screen anybody from the ages of 35. Your doctor may also check if you have other symptoms. And so if you are finding yourself that you're always thirsty all the time, you're always peeing, maybe you're a little bit overweight, maybe you have a family history of diabetes, certain things like that would trigger a doctor to check early. And so make sure you're going to see your doctor, getting those at least annual checkups to get these preventative type screening tests, and so that we can identify things early on. This is another that I feel fine, I don't need to see a doctor. It's a sort of a graphic representation of a comfort zone, which I feel fine. That's the reason why people don't go see a doctor. That going to see a doctor, even when you feel fine, gives us an opportunity to do some preventative screening. And you may not have any symptoms, you may or may not exercise, your health, you're probably busy, your health is not really necessarily a priority to you. And that can become a slippery slope. This is a straight line, but I sort of like to think of it as a curve like this, where if you're on the top, you can come down, you can be in good health, do some good exercise, take care of yourself, eat well, and be on your way to wellness, where all your joints work, you feel good. Whereas on the other side, someone who's not really taking good care of themselves but feels fine, as soon as they get sick, or as soon as something happens to them, their bodies aren't prepared for something like that. And so they can really start to slip off into poor health and then disease really easily. And so basically the further you are to the right of this graph, the harder it is for you to get to the left. And then, so we've mentioned prediabetes a couple times. Prediabetes is, as it states, it's before diabetes. It's increased sugars that have just not quite yet reached the level of diabetes. And we can identify this early on with the screening tests. If you come in, you're 35, and we screen for diabetes with the test, it's called an A1C. We'll do that test, and we can identify prediabetes before you get to the level of diabetes, and really is a good opportunity to get started on prevention and see if we can keep you from progressing to diabetes. And of course, even going from prediabetes to an A1C that is a normal level is the goal. And so if you get diagnosed with prediabetes, should you take a medication? Yeah, absolutely. Absolutely. Medications can really help supplement your dietary changes. Diet and exercise are always going to be the base. That's what we really are going to ask of you, is to take charge of this and work on diet and exercise. But medications can certainly help. Some medications can help you lose weight. And that can be motivating for someone trying to lose weight on top of that. And so if you have heard your doctor say you're borderline before, or you've heard them say that you're diabetic and you've been trying something, go see your doctor and talk to them about it and see if there's anything that you should do about it. A lot of the things, even medications we use to treat diabetes, can be used in a pre-diabetic. But of course, diet and exercise is really the base here, is what we want. The base of anything that we do for diabetes and pre-diabetes is diet and exercise. And so metformin is one of those medications. Again, I'm not going to go into all of them. I'm just going to highlight metformin here because it's usually the beginning medication that we start people on, which is a really good medication. It works in your liver, it works in the stomach, and it can really be beneficial in lowering blood sugars. And you may have heard someone say, I had metformin and it really caused stomach problems, and I really just couldn't take that. With everything, of course, we've learned a lot, and we know that metformin does cause stomach problems, but if you slowly increase the amount of metformin you take until you get to the effective dose, you can really mitigate those side effects. And oftentimes people won't have any if they start at a low dose. Increasing it approximately weekly, you can get to the effective dose while avoiding those stomach side effects. So if metformin is something that you've been scared of in the past, I'll tell you that there's new things that we can do. There's new ways that we can try to take this medicine, and metformin might be a good choice for you. And so let's say you're diagnosed with prediabetes, you're diagnosed with diabetes. What do you want to do? Most people that I see that I diagnose with diabetes, it's kind of a shock. It's a blow to them to hear they have diabetes, because there's lots of thoughts out there about diabetes and everybody has their own thoughts. But one of the common ones I hear is, oh man, I'm going to be on insulin for the rest of my life. And if you're a type 1 diabetic, as I mentioned before, that's true. That's an autoimmune disease where your pancreas isn't working. But with diabetics, that's not true. And I really want to empower those folks. And I ask them the question of, do you want to cure your diabetes or do you want to treat it? Because we can give you all the medication in the world and treat your diabetes if that's what you want. But I'm being absolutely serious when I ask them, do you want to cure this? Because you can cure it. And so if you were diagnosed with diabetes or pre-diabetes and you haven't seen your doctor, been following up lately, go see your doctor. Make sure you get an updated A1C and see how things are looking. Of course, start paying attention to the foods you eat, the amount of sugar that is in those foods. And then if you were prescribed any medications, make sure you're taking those daily, because they can really help a lot with lowering your A1C, lowering the blood sugars, and preventing all the things that we talked about previously here that can go wrong with diabetes. And so another question that that I might get is, I'm seeing someone for the first time who's had diabetes for years and years and years, and they just hate taking insulin, and they want to get off insulin. And so with insulin resistance, which is of course the beginning that we talked about, is the problem with diabetes. Too much insulin causes resistance in those cells. And so if you are using insulin, then you're sort of furthering that process. And so it would be beneficial, if possible, to get you off of the insulin. And sometimes that can't be done, and that's the truth. But if getting off of insulin is something that you are interested in, and you want to really go at this cure of diabetes, and you're willing to put into work with a diet and exercise, there's a lab that you can do, and we can do that here at the Morton lab. And so see your doctor, because we can tell you whether or not your pancreas is still producing enough insulin, and that can tell us whether or not you're able to get off of that insulin, because it may be that your pancreas is still working enough that we can help that process out. Yeah, and again, unfortunately, it may come back that lab level is too low, and that the insulin might be what you will be taking for the rest of this process. But the diet and exercise can continue to help lower the blood sugars on top of the insulin. You may even be able to reduce the amount of insulin that you're using. The bottom line here, and what I'm really trying to get at and drive home to you, is that you have the power to change your life. You really do. You need to be empowered to realize that you have the control here, and it's about what you do, the things that you put in your mouth, the kind of foods that you eat, whether or not you live an active lifestyle. If you're willing to put in that hard work, then you can essentially reap those rewards, and you can live long, you can live a healthy life, and you can be happy and in good health. And that's really the goal here. And so now I'll open it up for any questions that anybody might have. And I'm sorry I got cut off there for a little. I hope that we didn't miss too much. I think I noticed it.
Are there any questions from the group?
No questions, but I do appreciate the, I guess, the optimistic approach here to diabetes. It's hard sometimes as a doctor to give your patients hope when you give them a diagnosis of diabetes. And so this is kind of good for my toolbox to be able to talk to my patients about that, and good for myself too, to, prevent diabetes.
Yeah, it's true. Sometimes that diagnosis of you have diabetes is devastating, and it's hard to get through to them that it's really going to be okay, and that we can together work on this and we can cure it. But if you get buy-in from them, and so the folks who are listening, if you buy into that kind of thing and you realize that it is up to you and that you can cure this, it really is great. It's very fulfilling for the physician. It's really fulfilling for the patient. Some of the things I'm the happiest about are folks whose diabetes who I've met with A1Cs in the 13s and 14s. And, after a year or two, their A1C is actually normal. And sometimes they're off all of their medications, maybe still on metformin. It's very, magical in a way. And so it's very fulfilling.
I just want to contribute that, what he talked about is true. Personally, I had the privilege of working in a preventive medicine lifestyle center for a little over a year. And we had people who had, were on insulin 3-4 times a day, couldn't hardly do much. And within 3 weeks of being involved, they were able to, in some cases, be completely off insulin, and sugars well controlled. So it's a very powerful tool that he's talking about, and I think that's really cool that he's bringing this to the area. That's one of the areas, one of our goals in community wellness. That's one of my roles. I'm the director of community wellness at the hospital. I didn't mention that before. Is to try to help increase the quality of life of our constituents, people who live in our community, and that's our goal. It's not just to fix you when you get broken, but to help you to live a long and healthy life where you can have the power. So I appreciate that a lot.
Yeah, my pleasure. Thanks for having me.
Any other questions out there? All right. We want to just thank everybody for joining us. And again, thank you, Dr. Fabilski, for taking your time. We really appreciate it. And I think it's good for our community to know that we have providers that are very concerned about the wellness and their health, and rather than just helping people who are sick, but helping us to stay well. So thanks so much for that.
Yeah.
Absolutely. So thanks very much for that. And we just want to thank you and enjoy the rest of your evening.
Yeah, thank you, sir. You too. Bye.